What makes a cranial nerve mixed in anatomy? Have you ever wondered what makes a cranial nerve mixed? Let's break it down in a simple way. A cranial nerve is termed mixed when it has both sensory and motor nerve fibers. This means it can do two important jobs at once. First, sensory fibers carry information from sensory receptors, which can detect touch, pain, temperature, and even special senses like taste and smell. These fibers send this information toward the central nervous system, which is the brain and spinal cord. On the flip side, motor fibers transmit signals from the brain to muscles or glands. This allows the body to produce movement or secretion. So, mixed cranial nerves are like a two-way street, receiving sensory input and sending out motor output. In the human body, there are 12 cranial nerves, and 4 of them are mixed. These are the trigeminal nerve, the facial nerve, the glossopharyngeal nerve, and the vagus nerve. Each of these nerves plays a vital role in various functions. For instance, the trigeminal nerve is responsible for carrying sensory information from the face. It also sends motor commands to the muscles involved in chewing. The facial nerve controls the muscles of facial expression and conveys taste sensations from the front 2/3 of the tongue. The glossopharyngeal nerve is involved in swallowing and transmits sensory information from the throat and carotid body. The vagus nerve has a broad role, controlling the muscles of the larynx and regulating autonomic functions in the thoracic and abdominal organs. It also receives sensory input from these regions. The combination of sensory and motor fibers in these mixed cranial nerves allows them to coordinate complex responses that are essential for functions in the head and neck. For example, if you bite into something hot, the trigeminal nerve helps you feel that heat and also allows you to react by moving your jaw. Understanding which cranial nerves are mixed and what they do is important in anatomy and clinical practice. Damage to these nerves can lead to both sensory and motor deficits. This can affect essential functions like chewing, facial movement, swallowing, speech, and even autonomic regulation. This knowledge is crucial for diagnosing neurological conditions and planning surgical procedures that involve the head and neck. So, when we say a cranial nerve is mixed, it means it has the ability to perform both sensory reception and motor control functions. This dual capability is key to the complex neural regulation of the head and neck region.